So I am Colin Rock, head of partnership sales here at Black Health Matters. And following that heart pumping workout, we're now going to talk about hypertension and heart disease. African Americans have a 40% higher risk of experiencing hypertension than our white counterparts, unfortunately. However, we are less likely to take the proper steps to manage our blood pressure levels. As discussed on our website, blackhealthmatters.com, many individuals do not know that they have the condition. Symptoms begin to manifest only after damage has been done to our heart and blood vessels. Some of the risk factors that affect us are being overweight, having high cholesterol levels, and unfortunately smoking cigarettes. We have an expert on heart disease to join us and talk with you about some of these issues. Dr. Brittany Fuller is a fellow of the American College of Cardiology and a fellow of the American Society of Echocardiography. She's an interventional cardiologist with the Edith and Benson Ford Heart and Vascular Institute, which is part of your Henry Ford healthcare system. She specializes in complex coronary interventions and mechanical circulatory support. Her other interests include cardio obstetrics and improving outcomes in pregnant patients with cardiovascular disease. Dr. Brittany Fuller, thank you so much for joining us this important session here for the Detroit area. We welcome your input.
Thank you so much, Colin, and thank you guys for being with us this morning. So I'm going to go over hypertension and a lot of things that Colin talked about and some of the things that we can do to decrease our risk of having high blood pressure. So what is hypertension? So as blood leaves the heart, it provides oxygen and nutrients to all organs in the body, and they travel through tubes called arteries. Blood pressure is essentially the pressure that's pushing against the walls of those arteries. So hypertension, high blood pressure is the exact same thing. That's when your blood pressure is higher than normal, which is over 120 over 80. And I'll get into what those numbers mean and how we get to those. So I'll refer back to this, this slide and later on, but normal blood pressure, your systolic blood pressure is that top number and your diastolic is that lower number. Again, I'll kind of get into how we get those numbers. Normal is that top number is less than 120, that bottom number is less than 80. That's normal. Elevated is when you get into that top number ranging between 120 to 129, and that bottom number is still less than 80. You get into high blood pressure or hypertension when that top number is 130 to 139, and that bottom number is 80 to 89. You get into a higher stage of hypertension or high blood pressure when that top number is above 140, or that bottom number is above 90. You get into the hypertensive crisis, needing to get in to see your doctor immediately when that top number is above 180 and or that bottom number is above 120. So why does this matter? So according to the CDC in 2018, high blood pressure was the primary cause or a contributing cause of death in nearly 500,000 people in the United States. Over 100 million adults in the United States now have high blood pressure and are taking blood pressure medications. And unfortunately, only half of these people have their blood pressure under control, which is under that 130 over 80 mark. High blood pressure, as Colin correctly stated, is higher and more common in non-Hispanic Black adults. Many people develop high blood pressure in their late 30s to early 40s. But unfortunately, because of the obesity pandemic, we're actually seeing more and more young people developing hypertension. So it's not just the 30 and 40-year-olds, we're actually seeing it earlier in the 20s, in the 20-year-olds as well. So hypertension or high blood pressure puts you at risk for heart disease. So heart attacks, Heart failure is when your overall heart muscle, just like any other muscle in your body, becomes weak and can no longer pump blood as effectively as it should. It puts you at risk for stroke. It also puts you at risk for kidney disease or kidney failure, which could eventually lead to dialysis. So how do you know you have hypertension or high blood pressure? Largely, there are no symptoms that are associated with high blood pressure, which is why it's called the silent killer. But if you do have any of these symptoms, it could indicate that you're suffering from a medical emergency. So headache, shortness of breath, nosebleeds, chest pain, chest pressure, dizziness, general feeling unwell. All of those things could indicate that either something else is going on, but if you have that in conjunction with high blood pressure, that means you need to get a prompt evaluation by a doctor, whether that be in the emergency department or your primary care doctor or someone, because high blood pressure typically, unfortunately, does not have any symptoms really associated. So how is high blood pressure or hypertension diagnosed? So this is where I talk about those two numbers. So typically, if you look at step one, there's nothing obstructing flow down the arm as the heart pumps the blood out into the aorta, it goes down into the arm. When we check your blood pressure, we put the cuff on the upper part of your arm. You can do it on the lower part of your arm with the wrist cuffs, but those are not as accurate. So you want to get one that actually goes on the upper part of the arm. You inflate the cuff, it blocks blood flow down the arm temporarily, momentarily. As you slowly decrease the pressure, the first sound that you hear is that top number, is that systolic pressure. As you continue to deflate the cuff, you'll continue to hear a pulse, and when the sound stops, that's the diastolic pressure. So that's the lower number. Again, normal is 120 over 70. It's when you start to get over into the 130s over 80, that's when you start getting into hypertension. And you want to make sure you have an appropriately sized blood pressure cuff. So I get this question a lot in clinic, and I often tend to counsel my patients on how to check their blood pressure, how to get an appropriate sized cuff. You want to take a tape measure, a cloth measuring tape, measure midway between the elbow and the shoulder, and that is going to be the cuff size range that you want to look for. When you take your blood pressure at home, you want to make sure you're sitting in a sturdy chair. Your back is resting against the back of the chair. Your feet are both flat on the ground. Don't cross your legs. Don't cross at the ankle. Make sure that your arm is at the level of your heart. So if you're resting on a table, so whether you put a blanket or a pillow or something to kind of elevate it, that's fine. Rest for 5 minutes. Make sure you go to the bathroom before, because that can actually, having a full bladder can actually increase your blood pressure as well. And then you want to wait 5 minutes, kind of relax, wait, don't talk as you press the button, then check your blood pressure. You want to measure your pressure in the morning, right after you wake up, or in the evening before you go to bed. And you want to try to measure it at around the same time every day if you can. So you can get a blood pressure cuff from many different places. I tried to put on here some of the more reasonably priced ones. Again, you want to try to get an upper arm cuff. The wrist cuffs just are not as accurate as the upper arm cuffs, and actually are slightly more pricey. But Rite Aid had a reasonably priced. Target, CVS was a little more pricey, Meijer even as well. And we'll get into questions too. So before I get into medications, I do have a question about can blood pressure meds cause hair loss? Just like with every medication, yes, there can be some side effects with it. To be honest, I haven't heard of anyone having hair loss except for with some of the diuretics, which I'll get into in just a second, okay? So hypertension treatment or high blood pressure treatment, prevention is key. So that's mostly lifestyle changes and then medications. So again, I just wanted to refer back to this slide. Your normal blood pressure, that top number less than 120, that bottom number less than 80. Elevated is in that range of that top number 120 to 129, that bottom number less than 80. High blood pressure, we're getting into that top number above 130 to 139, or that bottom number 80 to 89. We're getting into stage 2 or worsening high blood pressure when that top number is above 140 or that bottom number is higher than 90. And then you're getting into severe hypertension or severe high blood pressure when that top number is above 180 and that bottom number is above 120. So prevention, eating a healthy diet, plenty of fresh fruits, vegetables, grains. Most importantly though, because African-American patients and African-American people in general don't process salt as well. So lowering your salt intake is going to be key. So you want to target no more than 2,300 milligrams of sodium or salt in a day. If you can limit to no more than 1,500, it's going to lower your blood pressure even more. So looking at nutrition, your nutrition labels, you want to pay close attention to the sodium and then your serving size. So whatever this label is for, 160 milligrams of sodium is the salt that's in that product. And then you want to look at the serving size, which is 2/3 of a cup. And you want to try not to, especially if you are on more than one agent, you want to try to limit your sodium to no more than 1,500 milligrams in a day. If you are preventing hypertension or on one agent, you can try to shoot for a target of no more than 2,300, but ideally the lower the better. You want to maintain a healthy weight. Exercise is huge. I recommend, and even the ACC and the AHA recommend that you get at least 2 hours and 30 minutes of moderate intensity exercise every week. So that factors out to be about 30 minutes a day, 5 days a week. It can be brisk walking, biking, elliptical, aerobic exercise, it doesn't matter, but it has to be a dedicated 30 minutes a day. Taking the stairs at work and things like that help, but you have to start to, kind of carve out that 30 minutes a day because that's also going to lower your blood pressure as well, a good 5 to 10 points. Smoking not only raises your blood pressure, but it does put you at a significant risk for strokes and heart attacks. So if you are smoking, you got to quit. If you don't smoke, don't start. You have to limit your alcohol use because alcohol as well can increase your blood pressure. Men should ideally have no more than 2 alcoholic drinks per day. And these are standard servings. And women should not have more than 1 alcoholic drink per day. And you want to try to get enough sleep. Ideally 7 to 8 hours of sleep if you can. So I'm going to talk a little bit about medications, and I did kind of put them on here with some of the generic names and also brand names so that if you're on some of these medications, you kind of have an idea of what I'm talking about. So this first slide on medications, I'm talking about the ones that we try to start with for African-American patients because they're the best treatment options to start with initially if we can. The first one is a diuretic or water pill. Examples of those are hydrochlorothiazide, which is the generic, or chlorthalidone. These are just like they sound, they're water pills. You'll ideally have to take them in the morning or else you'll be up all night using the restroom. This one, you do require your doctor should check your salts in your body because it allows a lot of salts to leave your body when it diureses you or removes some of the water. Things you can, and it can actually lower your potassium levels because of that. So things you want to do to lower the risk of having low potassium levels is to have a low salt diet. So this is one that when I start this medication, I make sure that we get blood work to check your kidney function and check the salts in your body about a week after. If your salts do become abnormal or your potassium is low, the thing that we do is just give you a supplement, or we tell you to eat a little bit more potassium in your diet, bananas, kale, things like that. The second class of medication is also a very good initial treatment option for African-American patients. The class is calcium channel blockers, also known as nifedipine or amlodipine. These medications are very well tolerated. They do not require a lot of blood work afterwards, and they are really good at lowering blood pressure. The main side effect that I have noticed in patients is that it can cause swelling in the feet and ankles. That does not cause any harm, but it can be uncomfortable. So, if it happens, we stop it and we can try something else. There's no long-term effects from that. These two medications, or these two classes of medications, I'm sure a lot of people have heard about, particularly the ACE inhibitors, which I'll get into. But the first class is the angiotensin receptor blockers, or ARBs, or ARBs, which you may hear referred to as. Examples of those are losartan or Cozar, amlosartan or Binocar, temlosartan, valsartan. These medications are excellent in treating blood pressure, particularly in patients that have diabetes, kidney disease, heart failure. These medications help kind of remodel the heart muscle when you do have heart failure. And when you do have a weak heart, it helps remodel the heart muscle and kind of strengthen it back up. So that medication is excellent in treating blood pressure in specific patients, and with particularly those with those type of conditions. Now, the ACE inhibitors, or the angiotensin converting enzyme inhibitors, which are your lisinopril, enalapril, benazepril, ramipril, those also work very similar as the ARBs, the ones above, but these are the ones that have the higher risk of the allergic reaction, which I'll get into in the next slide. But again, both these two classes of medications are very good at treating high blood pressure, particularly in these type of patients that have diabetes, kidney disease, heart disease, or heart failure. Another class of medication, which is not the best first treatment option for blood pressure, are called beta blockers. So those are your metoprolols or low pressor, Toprol XL, carvedilol or Coreg, atenolol or tenormin, bisoprolol, propanolol, or nadolol. These medications, again, are not the best first-line treatment for high blood pressure, but we do use them, especially in patients that have had heart attacks, that have stents placed, that have bypass, that have weak hearts or heart failure. Also, those patients that have abnormal heart rhythms or fast heart rates, atrial fibrillation, atrial flutter, those medications are fantastic for treating those conditions. They can help with blood pressure a little bit and have some blood pressure effect, but they're not the first line treatment for high blood pressure. So this, I've seen this all over the internet a number of times. I can tell you, I see patients in clinic once, I have clinic once or twice a week, and I get asked this question at least once. ACE inhibitors, so your lisinopril, enalapril, benazepril, ramipril, those, the medications that I talked about that are good for if you've had a heart attack, if you have diabetes, if you have kidney disease. Those medications are excellent in treating those conditions, especially in association with high blood pressure, but they can cause what's called angioedema, which is swelling that most commonly affects the lips, tongue, face, or upper airway. It's actually quite rare. It happens at roughly 0.1 to 0.7% of patients, but unfortunately in patients that are of African descent, African American, the risk is actually 5 times greater. So I tend to not start with that medication. I tend to go with the other one, the ARBs, the ARBs, the losartan class of medications, as opposed to lisinopril in African American patients. If you are on this medication and you're tolerating it, it does not mean that you're going to develop a reaction. But one of the first things that we look for is that if you have a cough, if you develop a very dry cough after starting the medication, that could be a sign that you could have that swelling or angioedema. So we recommend you immediately stop the medication, notify your doctor. It goes on your allergy list as an allergy, and you should not try that medication ever again. If you do have swelling or this what's called angioedema, that typically resolves in about a day, 1 to 3 days. But I always counsel patients that you should monitor yourself over the next months to even up to a year, because you can have recurrent symptoms. Very rarely, it can be life-threatening in some cases. So especially if you have swelling and anywhere on the face, you should actually get immediate attention, because that can affect the airway. We have to make sure your airway actually looks okay. Unfortunately, there's no standardized genetic testing or lab testing. We can't really identify which specific patients are actually at risk. We just know that there is a 5 times greater risk of this reaction in African American patients or people of African descent. Again, this class of medication is instrumental in treating conditions heart disease, heart failure, kidney disease, but the alternative to that is to use the other class of medications, which is what I typically tend to do, the losartans or Cozars, Benicar, Valsartan, things like that. Even though there's similar classes of medication, if you've had a reaction to the other one, that does not mean that you're going to have a reaction to the losartan. Very rarely does it happen. So if your doctor takes you off of lisinopril and puts you on losartan, that's perfectly safe. So I'm going to get into some questions, but again, prevention is key. You want to maintain a healthy weight. You want to focus on your diet, ideally limiting or avoiding sodium, get physical activity, aim for 30 minutes a day, 5 days a week. I never tell people to get off the couch and start training for a marathon. It's going to ruin your self-esteem, and you're not going to want to do it after a day because you're going to be sore. So I always tell them to start slow and start low. So start 10 minutes a day, dedicate 10, 15 minutes a day. If you're moving so fast where you can't breathe and you can't talk and hold a reasonable conversation, you're moving too fast. Slow it down, and then work your way up over time to 30 minutes a day, 5 days a week. If you smoke, quit. If you don't smoke, don't start. Limit your alcohol use. If you are prescribed medication, because despite our best efforts and all of these, primary prevention and modifications, you still may need medication to bring your blood pressure down. Take them as prescribed. Get a blood pressure cuff from one of your local drugstores. Again, upper arm cuff is going to be not only more cost friendly, but it's also going to be more accurate. Keep a log of your readings and make sure you follow up with your doctor regularly. And again, just kind of some simple, accurate readings. Make sure you put your blood pressure cuff on your bare skin. Try not to put it over clothes. If it can actually add 5 to 50 points, depending on what kind of shirt you have on. If you don't have it on your bare arm, use the correct size, cuff size. If the cuff is too small, it'll increase your blood pressure points. Make sure your back is supported. You're sitting in a chair, feet flat on the floor. Don't cross your legs. Make sure you empty your bladder and don't talk. All right, and let me look at the questions here. So can some high blood pressure medications cause hair loss? Again, every medication has some side effects. I have had some patients note hair loss with Norvasc or the diuretic medications, but typically we stop one, see what happens, and then kind of go from there. Can you get the slides of the presentation? I will see what I can do. So why would African Americans not process salt? Well, so that goes into a lot of physiology that I didn't want to go into today, but there are enzymes and things that we have in our kidneys that just that hold on to salt far more, patients of African descent, far more than of white patients, which is why we hold on to it, and which is why diuretics work so well for us, because it actually helps get rid of it. Are there special things to know about hypertension and COVID? Not that I'm aware of. You should, if you unfortunately do develop COVID, you should obviously watch your blood pressure closely, because anytime you're infected, your blood pressure can go down and you may have to adjust your medications a little bit. Having hypertension, being obese, having heart disease, heart failure, kidney disease, diabetes, all of these things actually increase your risk of having COVID. So, or actually having an adverse outcome with COVID. So those are things that obviously we want to be more proactive than reactive. So getting things under control. But now that we're here, exercising, taking your blood pressure meds, that's going to be the best thing that you can do to combat hypertension with COVID. Could you explain why Black Americans tend to have higher rates of hypertension compared to white Americans? So there's a couple of things. There's the inherent, like I said, the processing of salt and sodium in our bodies is different than in patients that are not of African descent. But yeah, there is a lot of distrust in the medical system. And there's a lot of distrust in medications. African Americans tend to not go to the doctor as frequently. they tend to, be distrustful of medications, and they tend to say, well, okay, I'll try to do things without medications, and that tends to delay them starting medications. So I typically give a very short window of preventative measures. I still recommend exercise and diet, but I typically, after I see you and I see your blood pressure is elevated, I give you a good 3 to 6 months to make changes. If you do not make those changes and your blood pressure does not make positive trends along with your weight, then I don't push it back for a year. I actually start medications at that point. There are a lot of providers, and that's not, and I'm not saying it's wrong, and I'm not saying my system is correct, but we'll say, okay, we'll follow up in a year. Your blood pressure is elevated, but you're going to make these lifestyle changes, follow up in a year. I tend to not do that, especially if you're in that 140 range and above. I don't do that. I follow you up closer than that and get you on medications. You can still do those things and do those lifestyle modifications, and I'd rather take the medication back down than to keep you untreated for longer. What are the side effects of these drugs? So the side effects of the diuretics, like I said, they can cause the salts in your body to become abnormal. It can also cause your kidney function to be abnormal temporarily. That's why we check your kidney function, which is a simple blood test, about a week or so after you start the medication. So that's the hydrochlorothiazide, the chlorthalidone. Low potassium is also a side effect of that, and it makes you go to the bathroom quite a bit. But the treatment for that is we give you potassium supplements and things. The Norvasc, as I kind of stated, the major side effect that I've seen associated with that is swelling in the legs or the ankles and feet, which goes away very quickly after you stop the medication. The losartan or the losartan lisinopril class, we kind of went over those. Do any of these medications damage your kidneys? No. They can cause your kidney function to be abnormal temporarily, but they don't damage your kidneys. Well, we have access to this PowerPoint. I will find that out for you and let you know. Would there be a reason for the bottom number to be high and the top number to be normal? So actually, we see that a lot in younger people, where that bottom number will be high and that top number will be in the relatively normal range. And that's when that's when at least my red flag goes up and I say, well, okay, we got to work on aggressive risk factor modification. That's just a sign of how stiff the arteries or that the tubes or arteries, that they're becoming stiffer. So that's one of the signs that we got to start getting on your blood pressure soon. We typically see that more in younger people. If you have COVID, should you stop your ACE or ARB? Absolutely not. There was some concern initially with that, and there were some studies or some triggers, not really studies, that were concerned that if you have COVID, you should stop your ACE or ARB. Nothing in the research has panned that out. So no, you should not stop it. Are diuretics bad for you? No. They're really good blood pressure medications if you can tolerate them. Trying to get through as many questions as I can here. Are there any medications that don't interact well with high blood pressure medication? So there are some medications, depending on what your condition is. I would recommend that if you have specific questions about your medications, that you make sure you bring all of your medications or a list of them to your doctor's appointment so that they can go through that with you. Do ARBs or ACE inhibitors cause erectile dysfunction? No, it's more the beta blockers or the low pressor, toprol, carvedilol, those medications that can cause erectile dysfunction. But if you're on those medications because they're not the best blood pressure medications, that means that you should be on them for a reason. You've had a heart attack, you have heart failure, you have a fast, rapid heart rate, things like that. Does your emotional state affect your blood pressure? It can temporarily. But if it's something, if you're stressed out and your blood pressure is consistently elevated, then you likely do have underlying high blood pressure and you should get that treated. What is the chance of not having to take high blood pressure medication once you're on high blood pressure medication? It's very tough to get you off medication once you're on it. Once you've, unless you just, again, despite our best efforts of exercising, eating right, lowering our salt intake, there is a huge genetic component to high blood pressure. So once you're on the medication, the chances are there will be lifelong medications. You may, with lifestyle changes, weight loss, diet, exercise, be able to decrease some of those medications or even decrease the doses. But there's a high likelihood that once you're on medication, you will be on medication for life. My blood pressure has been 135/80 for the last 3 years, but my former current doctor hasn't put me on meds. Should I be concerned? I would follow up. I mean, you don't necessarily have to be concerned, but I would certainly get a cuff, a blood pressure cuff, and keep a log at home. And if it's consistently elevated, then absolutely follow up with your doctor. Can blood pressure be reversed once you're on medication? Again, you can likely decrease some of the doses or even come off if you're on 2 or 3 agents, decrease the number of agents that you're taking. But typically when you're on those 2, 3, 4 agents for your blood pressure or 4 blood pressure pills, the chances of you coming off of them completely is quite low. Do you know the best nutrition for those that are hypertensive? Low salts. Low salts is going to be key. Is lisinopril a good medication for blood pressure? It can be a good medication for blood pressure in the right setting. It's not the best first-line medication for African American patients. Purely with high blood pressure, lisinopril is not the best option. Now, if you have other conditions, diabetes, heart disease, heart failure, kidney disease, yes, it's an excellent medication. But as first line for just pure high blood pressure, it's not the first line choice, no. What is too low for pressure? So what is too low for a pressure to be before you take your meds? Now, if your blood pressure, so that depends. So if your blood pressure normally runs with medications 100 to 1, the top number is 100 to 115, that's fine. But if your blood pressure drops below 90 and you feel it, you're lightheaded, dizzy, you feel like you should not take your medication, then you should actually follow up with your doctor to see if maybe you're on too much and the dose should be back down a little bit. But I'd say if that top number is below 100, below 90 to 100, then before you take, and you feel it, so you're lightheaded, dizzy, feel like you're gonna pass out or anything like that, then you should not take it. You should definitely follow up with your doctor. What is considered a danger level or high reading on a blood pressure that should be reported to your doctor? So that's above that 180, above that 180 mark. Above that, that top number above 180 is when you really should get concerned. That bottom number above 120, you should really get concerned. Those can actually lead to emergencies. And especially if you feel it, especially if you have any of those symptoms that we talked about, you should absolutely either call EMS and get to the emergency room. If you don't feel it and your blood pressure is that high, then you should call your doctor and get in to see them quickly. Could these medications by any chance cause high potassium levels? In certain cases, yes. If you have baseline kidney dysfunction, yes, it can cause high potassium levels, which is why when we start it, we have to make sure that you're on, that we follow your lab work very closely. Am I accepting new patients? Yes. Always happy to see you. Do blood pressure meds have an impact on your liver? No, not that I'm aware of. And it looks like we can, we can actually have the slides available for download for you. Dr. Kanisha Evans, congratulations, good to see you, or good, thank you for showing up. How accurate or useful are the EKG functions on things like Apple Watches for monitoring blood pressure? So the EKG function monitors the pulse, not the pressure. So it's not gonna measure your blood pressure at all. It's only gonna measure your heart rate or your pulse. So you will need to get a blood pressure cuff to look at your blood pressure. What range do you start lifestyle modification, and what is your cutoff for starting medications immediately instead of lifestyle modifications? So when you start to get above that, get into that early range, that pre-hypertension range, that 120 to 129, or that number 80 to 89, that's when I really, even my younger patients, I say, hey, you should really start working on your diet, exercise, things like that. I try to, like I said, I try to give you a short period of time to make some of these changes and see if with pure lifestyle changes, your blood pressure will come down. When you get into that 140 range and above for that top number, it's unlikely that pure lifestyle changes will make a difference, but I still give you some time. I give you 30 days, 60 days, 90 days to see if we can make some changes and then start medications if we can't get your blood pressure controlled like that. Will a cardiologist check your salt function? Yes. It's just a lab test. Is there a way to test your sodium levels at home? No, unfortunately. So I'm just trying to get through some of these questions. Some of them I've already answered. Is lisinopril a first-line therapy for hypertension with diabetes? It can be, yes. So lisinopril, losartan, those medications are good because they actually protect the kidneys, particularly in diabetic patients. So it can be first line in that case. When is a good time to switch blood pressure meds? If and when you've been on it for a long time. If it's not broke, don't fix it. So if you're on blood pressure medication and your blood pressure is very well controlled, there's no need to switch it. How often should you take your blood pressure at home? I'd say, I always tell people once a day or twice a day, no more than that, 3 to 4 days a week. You don't have to go crazy and check it every 15 minutes on the hour. It'll only stress you out and your blood pressure will actually go up. So once a day, once or twice a day at max, 3 to 4 days per week. Again, so, good first line medication for African Americans, either the diuretics, which are the water pills, or the calcium channel blockers, so your nifedipine or amlodipine. Is there a link between these medications and memory loss? Not consistent on the data, no. What is very well controlled if you're on 2 agents? So that 120/70 ideally. And do beta blockers cause depression? No, it can cause fatigue, but they do not cause depression, no. Okay, I think I've gotten through. Oh, we've exceeded time. Thank you so much, everyone, for coming in, and I do appreciate all the questions and comments. I hope we were able to I hope I was able to answer everything that we went over. If you have any questions, but thank you guys for showing up. I really appreciate it, and have a good day.